So today we're going to talk about management of heel pain, in particular plantar fasciitis, because that's the most common cause of heel pain. So we're going to talk about how we as therapists approach the management of plantar fasciitis and all the things that you can do to also help. So I don't know why we've got a yellow mark down the screen. I don't know if you guys could see it, but there's a yellow line down my screen, and I don't know why it's there, but we'll press on. Just for those of you who don't know me, I'm a musculoskeletal physiotherapist. I've actually been in practice for about 40 years, and my special interests now relate to rehabilitating tendon problems, and of course plantar fasciitis, heel pain is one of those, and shoulder and neck problems. And about 5 years ago, I started using Shockwave Therapy to help tendon problems. Went overseas, became a certified Shockwave Therapy practitioner. Now, heel pain felt under the heel and sometimes along the arch of the foot is most commonly, in fact, just about always, plantar fasciitis. And you'll see on the screen, I've actually said it's more correctly called plantar fasciopathy, because fasciitis suggests that it's an inflammatory problem. It's actually not an inflammatory problem. It's a problem with the health of the tendon where it attaches to the heel. So plantar heel pain is the most common foot condition treated by physiotherapists. And it's the most common foot complaint of all, occurring in about 10% of the population. So what it is the plantar fascia extends from underneath the toes, running back in a band and attaching to the underneath of the heel. When we get heel pain, it's actually this attachment of the plantar fascia to the heel. So when I palpate someone with plantar fasciitis, I will feel a thickening underneath the heel, just where the plantar fascia comes and attaches to the heel. And that area will be not only thickened, but it'll be tender for me to palpate with my thumb. And it'll be especially painful to put pressure on it when you stand or walk. So what's tendinopathy? I won't go through this whole slide, but reactive tendinopathy is where we have various reasons for the tendon to be disrupted, and it doesn't heal properly. And it's trying to heal, but failing to heal. So left long enough, it goes on to degenerative tendinopathy, which can ultimately lead to tendons rupturing. What we need to do is to change this so that it goes back into healing and regenerating. So the usual symptoms of plantar fasciitis, and those of you who are online today who are here because you do have heel pain will know these very well. So the most common symptom is that when people get up first thing in the morning, they have a lot of pain. They can often not put their heel to the floor. And the first few steps in the morning are really, really painful, sharp pain. And as they walk around, it eases off somewhat and then gradually fades, maybe completely after a few minutes. But the same thing can happen after prolonged sitting. So just sitting down for an hour or so, get up, the first few steps, sharp, nasty pain under the heel again. And when you palpate under the heel, it's tender, and perhaps tender along the plantar fascia, but especially where the plantar fascia attaches to the heel. And it feels thickened in that area where I palpate it. If I've got two patients who has one heel that's painful, one not, palpating the painful heel feel quite thickened and swollen compared with the other one. So when you first get up in the morning, if it's painful, you'd be limping, and sometimes people, it's so nasty, the pain, that they're limping pretty much all the time. When they first come in here, if a patient limps in and they haven't been sitting for a long time, but they're limping continuously, I know their heel is pain problem is particularly nasty. And also it can get worse again towards the end of the day, just from having been on your feet all day. So it's worse, of course, walking barefoot, especially on hard surfaces. So if people have hard surfaces at home, I encourage them not to wear bare feet at all, because that's just irritating the plantar fascia attachment to the heel. And some shoes are much, much worse than others. So going shopping, the worst thing you can do is wear some hard-soled flat shoes. So the sort of shoes you choose to wear are going to make a big difference. Now, let's move on. So what contributes to getting this plantar fascia in the first place? Oops. Well, it's caused by a repetitive overstretching of the plantar fascia. And so the most common thing I see is that people have changed their amount of walking they're doing. So that could be something as simple as going on holidays and walking every day a lot, especially if you're not wearing a good footwear like joggers or sneakers. Just wearing plain flat sandals and then walking a lot is enough to set off plantar fascia pain. But some people have abnormal foot biomechanics, and usually this is flat feet or feet that roll inwards at the ankle. And if people with that sort of thing don't wear orthotics to correct that rolling inwards, or in fact have orthotics but just don't wear them, then that is going to predispose them to getting pain at the attachment of the plantar fascia, because the plantar fascia is under more stress when your feet roll inwards. And of course, people who are on their feet all day at work are more prone to getting this sort of problem. I do see patients like, let's say, nursing staff, police officers. In fact, this used to be called policeman's foot, because policemen always used to walk the beat. And so they were on their feet walking all day long. And so we also see people who with running sports who've maybe increased their the amount they're running suddenly, which we would call a training fault, and then develop heel pain. And like I said before, it's a sudden increase in your in the amount of walking you do on a regular basis. Like someone joins a walking group, which is great for fitness, but if you've not been walking a lot and you suddenly are walking for an hour or an hour and a half on a regular basis, that can provoke the onset of plantar fasciitis. And of course, weight gain. Unfortunately, we do tend to get a little heavier as we get older, and carrying extra weight certainly loads up the plantar fascia more. And tight structures like tight calf muscles. So when I see someone with plantar fasciitis and I'm examining them, one of the first things I do is palpate their calf muscles to see how tight they are. And they are often very tight. So, and that can contribute, but so can stiff ankles and feet. So if the joints of the ankle and feet are not mobile enough and not moving naturally, then that's going to load up the plantar fascia again. And of course, poor footwear. You know, my eyes bug out of my head sometimes when I see the sort of footwear that people will come in when they come limping in with their plantar fascia heel pain, and they're wearing, you know, hard-soled flat sandals with no support. So my first advice to them is to wear better shoes, and of course wearing shoes that have some good heel cushioning, and not going barefoot on hard surfaces around the house. So commonly see that in summer where people are more likely to go barefoot around their house on hard surfaces, that their heel pain that they may have been just grumbling a little bit before suddenly flares up then. I've put diabetes on this list because with diabetes that's not properly controlled will contribute to poor health of tendons. And so therefore plantar fascia is more likely to become painful, as do other tendons in diabetics if their diabetes is not controlled. So I thought I'd give you your thing straight up that you can do to help with your heel pain before I talk about anything that we as physiotherapists can do to help you. I'd like you to start understanding straight away that you can really make a big difference to the progress of your plantar fascia pain. So we've already started to talk about footwear. So you want shoes that help maintain the shape of the foot. So we're really thinking of joggers, you know, of sports shoes that have a nice shape inside, that are nice and thick cushioning under the heel, and unfortunately people come and say, oh yeah, look, I'm wearing my sports shoes. Now look at their sports shoes, and I see the shoe may look all right on the surface, but when I take it and move it around, it's obviously past its use by date. It's not really offering much support. The shoes are many years old. So in some cases, I'm suggesting to people to actually buy some new joggers or sports shoes. Soft heels certainly help. I know that when I work, I wear black polished shoes, but I choose a specific brand that has quite soft heels, because those heels help reduce the chance of me getting heel pain, because I'm on my feet a lot. Now, when you already have heel pain, often putting some little cushioned inserts, little gel inserts you can just get from the pharmacy will also help reduce your heel pain in the short term. Now, the next thing I've got on this list is heat or ice. Ice is good for immediate relief, but heat is better in the long run. Heat will tend to, I believe, improve the circulation through the plantar fascia where it attaches to your heel. So, and heat is quite soothing. So the best thing to do is to use a hot pack on your heel, you know, just one of those grain-filled packs you can put in the microwave, and warm up your heel for, you know, 15, 20 minutes at least each time. And you can do that as often as you like. You will find it soothing of the pain. And there's no maximum number of times. So you just need to use that regularly to help improve the heel pain. And also, I get people to do gentle stretches of their ankle and calf, just using a band under the end of the foot and pulling back when they're sitting with the knee bent a bit. And those stretches are best done when you've had a hot pack on the heel for a while. So a lot of my patients get great relief from using a hot pack followed by some gentle stretches. The other thing is compression socks. There are these compression socks that are, and I don't know if you can see that in my picture of I'm showing on the screen. These are called Ortho Sleeve FS6. That's just one particular brand. These compression socks are designed by podiatrists to try and support the shape of the foot. And people get quite a lot of relief of their pain by wearing these compression socks. And in the first stages of when your heels or heel is really painful, you need to reduce all weight-bearing exercises. If you're a runner, stop running. If you're walking a lot, I would suggest that for at least the first week, you stop walking completely until start to settle that pain. And then you can reintroduce walking a little bit at a time, always using pain as your guide. If you walk for 10 minutes and that doesn't increase your pain, then great, you can build on that. But if you're continuing to hammering weight-bearing exercise, you will not settle down your plantar fascia, no matter what things that you do yourself or what treatment that we give you. So you need to back off on all weight-bearing exercise in the first instance. This is really difficult for runners who are addicted to their running, but take it week at a time. Just stop running for a week and then review how you're going. If you go back to running and your pain flares up again straight away, then it's too early to be running. The other thing is rolling a soft ball under your through the arch of the foot back and forwards is quite relieving. How hard you like that ball is up to you. I often suggest a very soft old tennis ball that's lost its oomph and it's quite soft, about that sort of firmness. Some people like to use quite a firm ball under their foot, but don't roll it under the painful part of the heel. You're just rolling it back and forwards up the foot to relax the muscles and help relax the plantar fascia. And you can massage that part of your foot too. You can massage it yourself. If you've got flexible enough hips, you can put that foot up on the opposite knee and just use your thumbs just gently massaging along through the plantar fascia. Or even better, get a friend or a spouse to massage your foot. You can tell them the physio's ordered it. Now, let's just go on here. So what's our approach as physiotherapists to treating tendon? This applies to all tendinopathies, but today we're specifically talking about plantar fasciopathy, so heel pain. Well, the first step in a combined approach is, the first thing I look at is what biomechanical problems are there. And by biomechanical problems, I mean things like pronating feet, so feet that roll inwards. If people's feet are rolling inwards, that's going to be contributing to their pain. If they don't have orthotics, I will often provide them with off-the-shelf orthotics, which is the most economic way of providing support for those rolling into the feet. And make sure that they're wearing good shoes with those orthotics to also support the feet. But, tight structures through the calf, so tight calf muscles especially, will need to be released. And that can be a hands-on treatment technique to release the muscles and specific exercises. There can be other biomechanical problems too. People will occasionally, there'll be people with quite weak gluteal muscles on that. And so strengthening and reactivating gluteal muscles will change the way that you walk and relieve some of the stress on the heels. So, but the first step in this, after looking at those biomechanical problems, is we want to get the patient to unload the tendon. That means resting off sport, resting off running or walking. So anything that's going to stress the tendon, in this case, the plantar fascia, we need to de-stress. So quite commonly, I'll see people who've been given a range of exercises to do by other practitioners. And those exercises may be all well and good at the right time, but if they're doing too much too soon, they'll actually be increasing their pain. So quite often I'm getting people to back right off. Sometimes for the first week, no exercises. Just let's settle the pain in the first week and then move on from there. Allied to this, I use shockwave therapy. Shockwave therapy I'll talk more about in a moment, but it's to help stimulate a new healing process and start reducing that pain as quickly as possible. Then as that tendon, or plantar fascia in this case, is starting to recover, then there are specific exercises to do, stretching exercises, strengthening exercises for various muscles, in the feet and in the calf. And I've already mentioned other physiotherapy modalities like releasing tight muscles, mobilizing stiff joints, like if there are stiff joints in the ankle or foot, they may need to be loosened up to get the foot and ankle moving normally. So if we can talk about shockwave therapy, because it's a mainstay and now recognized as the best therapy for heel pain, plantar fascia heel pain. So what is it? It's a mechanical, acoustic, that is, sound pressure wave. It's not an electric shock. Shockwave therapy is not a very good name. It sounds a bit scary, but it's actually quite a simple mechanical pressure wave. And where did it start from? Well, it actually started from using lithotripsy to break up kidney stones. But our machine that we use is nothing like you're seeing here on this slide. We use a handheld device, and it fires a little, using compressed air, fires a little projectile down the barrel, which hits the inside of the applicator head and creates a little shock wave out of the face, which penetrates deep into the tissues. So that shock wave is, we usually apply it around 8 shocks per second, and the treatment itself takes between 5 and 10 minutes, depending on how many shocks I'm applying to the area. So there is applying it to the heel. What that photo doesn't show is should be some gel, and usually that's applying it to the side of the heel. Usually it's more around towards that therapist's other hand, across the underneath of the heel. And we use some ultrasound gel as a contact medium to move that around smoothly during the course of the treatment. So what does it do? It stimulates a new healing response. That's the most important thing. That's what's going to get it better. When you talk about a tendinopathy, we're talking about an unhealthy tendon. It's not healing itself. So we need to stimulate a new healing response, just the body's own normal healing process. So and it causes new blood vessel growth at the same time, which also helps with the healing. So it's stimulating various body cells, the fibroblasts, they're called, to step in and repair. The fibroblasts are always active in your tendons, but it stimulates much greater activity. And it'll decrease the swelling under the heel. So, and that you'll see straight away. So by the end of one treatment session, you can palpate that the swelling has reduced considerably. And of course, what the patients like the most is that it reduces the pain. And that can actually happen immediately too, even after the first treatment. So it's not dependent on the whole thing healing to reduce the pain. So just a few things about shockwave therapy. What do you feel? You feel like a tapping sensation. Does it hurt? It can hurt a little bit, but that's under my control by keeping the output of the machine low. I never want it to be, more than just a discomfort. So most people will say that's perfectly tolerable. If it gets sharp, I turn it right down. So each treatment, the length of each treatment varies. The shortest at the beginning, but as we go along with successive treatments, I'll increase the number of shocks. So the treatment length of actual treatment time with shockwave during a physiotherapy session is between 5 and 10 minutes. The rest of the time is taken up with doing other things with you and exercises and so on. So it's a normal 30-minute treatment session. And can you keep on with your normal activities after each treatment? With the proviso, as I've said before, about reducing weight-bearing exercise, but you can go about living your normal life. You don't have to stop doing anything, except that I stop people from running, and I get them to, at first, dramatically decrease their amount of walking they're doing. How many treatments? Well, my normal protocol for treating heel pain is to give up to 5 treatments, 1 a week for 5 weeks. Occasionally, the condition will be settled enough to stop before the 5 treatments are up. More commonly, we give the 5 treatments, by which stage the patient is considerably improved, but not 100% better. And then we pause for 4 weeks while you go on with your exercises in your home program. Then we review. So if over that 4 or 5 week break from shockwave therapy, it's continued to improve steadily, or in fact, as the pain is resolved completely, then I'll just get people I'll update their exercises and they'll go along with their exercises. Should it not have resolved completely, or if it's not, doing as well as we'd want, then we may give a bit more shockwave after that. With this combined approach, we have about a 93% success rate. Statistics from research has shown that in the past, standard physiotherapy management of plantar fasciitis had about a 60 to 65% success rate. And when in the early days of shockwave therapy, they were showing that shockwave therapy by itself had about a 60 to 70% success rate. By combining both approaches, we can get that success rate to up over 90%. Can I take anti-inflammatory medication for pain? No. While someone's having shockwave therapy, it's been found that anti-inflammatory tablets actually reduce the healing response of the tissues. So while they give you reduced pain, they're also reducing the response of the soft tissues to the shockwave therapy. So I usually ask people not to take anti-inflammatory medication for pain. I'm giving them other ways of managing their pain anyway, like for instance, using heat and stretches. And you can always take simple pain relieving agents like Panadol, but not anti-inflammatory medication during the treatment process. On the other hand, if somebody has some other problem, then and you urgently need anti-inflammatory medication, taking anti-inflammatory tablets for a few days is not going to really give you a problem with your progress for your heel pain. How long does it take to get better? Well, that's the age-old question. Anything from 4 weeks to 4 months. It just depends. It depends a lot on how long you've had the heel pain problem for. Obviously, people who've had it for a shorter period of time will be the ones who make quicker progress. but I commonly see people who've come to me with heel pain that might have had it for a year or even 2 years. So those people are going to take longer. They're going to probably require more than 5 shockwave therapy sessions. Oh, I've always thrown this in here just for a bit of knowledge. The shockwave therapy I use for a range of conditions apart from plantar fasciitis and heel pain. So Achilles tendinopathy, patella tendinopathy, gluteal tendinopathy, and hip bursitis. That's a very common area. Seeing tennis and golfer's elbow, and rotator cuff tendinopathy, and other areas that are less commonly used, but shockwave therapy could be helpful. Now, I think I am ready now to take any questions. So if you would like to ask a question, just unmute your audio and ask away.
Hi, it's Sandy here.
Hi, Sandy.
Thanks so much for a great Zoom information session. My question is, can you develop plantar fasciitis from having a car accident, which then adjusted the way you walked, but it doesn't show for a few months?
Yes, look, anything that alters the way you walk can ultimately lead to plantar fasciitis. So I often see it with people who've got, say, knee arthritis, or even people who've had a total knee replacement, or a back problem that's giving you leg pain, and you alter the way you walk, and if it lasts long enough, because you're putting more pressure onto the heel, you can end up with plantar fasciitis.
Okay, yeah.
So that's not uncommon, for a whole range of other conditions that make you limp, or even if it's not an obvious limp, it just subtly alters the way you walk.
Yeah.
So the answer is yes.
Yeah, I'm pleased to hear it.
Yeah. So those sort of, obviously when I get someone like that, I also want to see if I can do anything to help their underlying problem that's causing them to walk differently as well, of course, because I don't want to treat their shockwave therapy and settle it down. I need to have them back again a month later or 2 months later with it flared up again because they're still walking.
Yeah.
Yeah.
Yeah. That makes sense.
Good. Okay.
Hello. Can I ask a question? Sorry.
You certainly can, Karen. Go ahead.
Thanks. Hi. Bruce, I had 8 months ago, I had surgery. I've had plantar fasciitis on and off on both my feet for the last probably 30 years. I'm 63.
Yes.
8 months ago, I had surgery to remove heel spurs, and they had to sever the Achilles tendon and rejoin it. 8 months later, I'm still got quite swelling in my heel and pain. So
is that underneath the heel or at the back of the heel, the swelling?
It's on the back of my heel. I've got a scar about 4 inches long on the back of my heel is where the surgery went in. I get most of my pain, even on my right, like I'm supposed to have my right foot done as well, but I'm kind of putting it off a bit.
Yes.
I was told it would take 12 months to heal. Most of my pain I get is on the inside of my heel, not so much. I do get it underneath a bit, but I'm wondering if this procedure, like the shock therapy would help at all, because, like seriously, the only reason I don't regret having it done was she actually found malignant melanoma on the base of my leg while she was doing my surgery. So she probably saved my life, actually.
Yeah, so even if it doesn't help you feel pain, it's been life-saving. So that's fantastic.
Yeah, I know.
Yeah, look, I see quite a lot of people who, over the years. I've seen quite a few people who've had surgery for various tendon problems, and the surgery has not really got rid of their pain. Sometimes help them a bit, but and so we've then given them shockwave therapy after the surgery with quite good results at helping to settle their pain. So so as far as I'm concerned, it's never too late to have some shockwave therapy. So, like for instance, I commonly see people who've had gluteal tendon repair because they get pain around the side at the back of the hip, and
that's what my mum's got.
Yeah, and the gluteal tendons can tear away from the bone, and they've repaired the tendon to sew it back down to the bone, which is good, but the pain, this pain still goes on. So we then shockwave that area, which helps relieve their pain. So shockwave therapy, if a tendon's pulled away from the bone, shockwave therapy is not going to get it to reattach to the bone.
No,
If it's been surgically reattached and then we shockwave it, we can reduce the pain that patient's getting.
Oh, well, actually, because my mum's 87, she's just had a gluteal muscle transfer in her thigh.
Yes.
And that's been successful, but her other thigh, she had hip replacement and repaired tendon 4 years ago. She's in excruciating pain with that at the moment. So do you think this would help her with that?
Possibly, yes.
As well. Oh, good. Well, we might both have to come and visit you.
Because in this clinic, we see a lot of people for post-op rehabilitation after orthopedic surgery, like hip replacements and knee replacements.
Yeah, this is actually how I came across you, because Mum goes, I think it's the same place where Mum goes for her physio in Nedlands. Are you on Stirling Highway in Nedlands?
Yes, the Rose Gardens, yes.
Yeah, that's where Mum goes. Yeah, she sees Jen Woodhouse.
Oh yes, yes.
Yeah.
And so often, if people are getting pain and it's ongoing and not settling after like a total hip replacement, and if it seems to be coming from the tendons in that area, then I can still shockwave those tendons even if they've had a total hip replacement.
Cool. All right, I'll stop talking and let someone else ask.
Okay, Karen.
Thank you.
Okay. So, any other questions?
Yeah, so hi Bruce.
Hi Christine.
Can you hear me? I've had pain in my heel for about a year now, and it increased a lot after I had my muscle tendon transfer for my gluteal tendons.
Yes.
It got really, really bad for a while. It has eased a lot. I've been doing all the stretching and everything you've suggested, but one podiatrist I saw suggested a cortisone injection, which I didn't pursue.
Good.
What do you think of that? I didn't like
don't go near cortisone injections for heel pain.
Okay.
Cortisone injections will give you some pain relief for a short term, from a week to a month. Cortisone injections stop the healing process.
Oh, okay.
So
that was a good decision then.
Yes, and I know that some, there's one particular rheumatologist who's an associate professor of rheumatology. He gets really angry when he hears of people who've been given cortisone injections in and around tendons, because it actually, can stop the healing process, which can weaken the tendon. So, a cortisone injection is only ever going to give you very temporary relief.
Yeah. So given that it's slowly improving, would it still be worth having some shockwave therapy?
When you say slowly, over what period of time?
It's been over the year. I mean, there was a time when I first got up where I could not put my foot to the ground at all. Yeah. I can now with some pain, but it was really quite quickly after a few steps. But it's still there, but it's 80% better than it was.
Shockwave therapy would certainly improve that recovery rate.
Right, okay.
So at the end of the day, it's sort of a personal decision about whether you want to just let nature take its course, or you'd like it to be sped up a bit.
Well, I'd like one side to feel good.
Yes, I bet you do. Yes.
Thanks.
Okay, thanks, Christine. Any other questions?
Can I just quickly ask out of curiosity, Bruce, is this, if you have private health cover and, you know, like your physio and all that, is this covered at all by your health funds?
Yes, yes, because we do charge a slight premium on treatments involving shockwave therapy.
Yeah, no, that's fair enough.
Because of the cost to us of the equipment, but it's still classed as a standard physiotherapy.
Okay, cool.
So whatever your health fund rebates for physiotherapy, that's what you'll
get. Oh, cool. Thanks.
Okay. That's actually a good question, Karen, because people often don't realise that when we're talking about shockwave therapy as a physiotherapist, we're just talking about physiotherapy. It's part of one of the things we provide.
Yeah, I know most people don't like to ask about money, but
no, it's a good practical question.
It's that's it.
It's the sort of question I would ask too.